Dr. Franco, tell me about a patient who came to you just desperate for a more defined waist and hourglass shape and had already been told by another surgeon that there's nothing that could be done. And what did she or he look like when she walked in and what happened?
Yeah, that's actually a more common question than you would think, especially in this day and age of everyone on their weight loss journey or GLP medications or, just eating right, as they would say. But no question, I think I've had obviously, I do a lot of liposuction, fat transfers, BBLs. And so I've had a lot of patients coming in for a round two or second BBL. They've been turned down by a lot of surgeons because they said, hey, you don't have any more fat. There's nothing left to do. And they're like, I'm not looking for a bigger butt. I'm just looking for a better shape. And in the past, we did have to trim the weight. There's nothing really left to do. Rib repositioning has changed how you think about that. I, in the past, have told a lot of patients, this is your body frame. This is what you were born with. This is how you were built. This is just what it is. And that is changing really rapidly. No question, we've all heard of these mythical rib removals, and there is a few certain circumstances where that can happen, but it's not for the masses. It's definitely a bigger recovery. Rib repositioning has changed this. A procedure under an hour, go home the same day, rapid recovery, but able to give you up to 4 inches of shrinkage of your waist. That's a massive transformation in a very short period.
That is massive in a short period. I will just repeat that. Amazing. I'm excited to learn more. But first, let's share with our beauty seekers a little bit about you. Dr. Johnny Franco is a board certified plastic surgeon, clinical faculty at the University of Texas Dell Medical School, and the founder of Austin Plastic Surgeon, one of the most recognized body contouring practices in the country. He's known nationally as the BBL King. Coming up, he's going to tell us why rib remodeling is nothing like what most people imagine when they hear the words rib surgery, and what it actually takes to get that snatched waist result to last. Stay with us, because if you want to enhance the results of a rib remodeling surgery even further, Dr. Franco is going to share how patients who want a fuller figure but do not have enough fat to transfer are getting an hourglass shape with no implants and no surgery. And it's just hitting the market. Dr. Franco, welcome to Beauty Seek.
Thanks for having me. This is super exciting. I think such a great topic. These are some of the questions we get all the time. People are excited about it. They just don't know where to go. They're not really sure what this is. It's almost this mythical treatment that you're unveiling.
Oh, yeah, totally. I was talking to my neighbor the other day and he was shocked. So I'm excited to be here, and thank you for welcoming me into your environment. Most people think the only way to get a smaller waist is to lose weight. On a scale of 1 to 10, how much can rib remodeling change the shape of the waist for patients?
Oh gosh, we're talking 7 or 8 for most patients.
Fantastic. And you mentioned 4 inches earlier. Was that ever possible with any procedure at all before?
It is when you think about overall body contouring, but when we talk about the very specific patients that are getting rib repositioning, if you think about it, this is our patients that are already super fit, that already have a good figure, just feel a little bit boxy, low BMI. So these are people who are really thin to begin with. So there's not really a weight loss option. They're in a good weight. It's about staying healthy, staying fit. So for those patients, there's no other option that's going to be able to give this type of transformation. In the past, those are the type of patients that we were sending away, which is frustrating because they work hard, they've taken care of their body, they've done all the things right, and then to still feel like they had no options, that's discouraging.
It is discouraging. And most patients hear the words ribs surgery and picture
Mhm.
something extreme, like a long recovery, ribs removed, weeks in bed. 1 to 10, how true is that narrative for you and your patients?
Oh gosh, I think that's about a one. People are really pleasantly surprised. It was funny. I was talking to a friend of mine, Dr. Alfredo Hoyas, and we were talking about these rib repositionings. He'll actually take a ultrasound image of the fracture because sometimes patients don't have enough discomfort after the procedure. They're like, did something really happen? Because I really don't hurt. And when we think about, moving these ribs, we're like, oh wow, this is like a broken rib or something. I'm going to be in so much pain. And we just have not seen that. And I'm sure we'll dive into it, but I think it has to do with some of the special instruments, some of the special techniques that we use for this procedure.
Let's go there because I think we patients hear rib remodeling. Well, what does remodeling even mean?
Yeah. So, what's interesting is you can actually do this through a percutaneous or a tiny little incision, usually half a centimeter or less. Sometimes even with newer techniques, something that's as small as an injectable port size. That's how small we're talking about. Because the goal of it, if you can see my finger here, is that we're just cutting one cortex of the rib and then moving it into position. There's some new specialized saw. They're called ultrasonic or piezotome saws. They're basically vibrating blades that are used at special frequencies that only cut bone and cartilage. The benefit of that is the safety. And so that way we're not hurting any muscles, any soft tissues, keeping you super safe with this. For anybody that's not familiar with this, if you've ever broken your arm something, remember a cast saw. So you can cut the cast off, not cut the skin. Very, very, very similar concept. That's how you can be super safe, but super effective through such a tiny, tiny little incision. But the hard part and the part where we need your help is we freed up these bones, but now we're in a corset to split this. The more you shrink that corset over time, the smaller your waist. It also gives you a lot of control because let's say you don't want that overly extreme tiny waist. You can stop at a point and be, I love my figure and just mold it right there.
Wow, amazing. Okay, and I'm just going to point to my ribs. Are we talking the bottom rib, the middle
Yeah,
rib, two
so
ribs?
it started with the what we call the free floating ribs, 11 and 12. So the last two ribs down at the bottom because they're not attached to the cartilage. And like anything, the techniques have advanced. If you think about it, when it first got described in Russia, actually, the incisions were much larger. Like most things, incisions have gotten smaller. Results have gotten better. Recovery's gotten faster. So we're able to do it through a much smaller incision. We definitely do the bottom two ribs in most people, and often now do the 10th rib as well, which also helps improve the overall shape. So this is usually incision. If you're going from the back, usually about 7-8 centimeters off your spine. So kind of right at that nice curvature of your back, which is ideal, right? Because if we're trying to bring that waist in, we want to be right at that point where that bone starts to come around the bend because the goal is to just move the overall waist. So you still have that nice round shape, but that super snatched round shape.
Okay, thank you for sharing how close it is to the spine. I did not understand that. Now I understand. Okay, fantastic.
Because you're moving and you're just pushing just the distal tip. And so when you push just on the tip, it all comes around together. So you're not pushing everything in, you're shrinking the waist.
Gotcha. Okay, now after the surgery, there's one practice that is essential to getting the hourglass figure. If that practice is not followed, how likely is it that an hourglass shape is achieved?
Ooh, one. I think this is one of the procedures where you have to help wearing the corset, splinting that into position and actually shrinking it over time. Most of our patients will downsize a corset at least once or twice during their 3-month journey to be able to get that waist into the perfect spot.
Okay, so the practice is wearing a corset for 3 months.
hmm Yeah.
Full time?
I mean, we'll let you take it off the shower, but that's about it.
Really? Okay.
Mhm.
And
And,
okay.
and honestly, the more you wear it, the more comfortable. Because if you think about it, if you ever sprained your wrist, sprained your ankle, when you add that support, that bone's not moving, that soft tissue. So it actually splints it into position. Most patients, once they get into a good routine with it, it actually makes it more comfortable. People actually tend to recover a lot faster. They're able to do more because everything's splinted and supported really well. So they can get back into their life really quickly.
Okay. I love that. So, part of the requirement to get the hourglass figure is surgery and then a corset for 3 months. And if they don't wear the corset, you're not getting that hourglass figure.
You're likely going to be back to where you started because your body's going to rebound. Your stuff, everything's going to shrink. So because we're not doing anything to support it, the weight, the corset is really guiding that bone into where we want it to heal.
Okay, amazing. And then do you recommend any particular kind of corset or
Yeah, every surgeon has their own preferences. This is where I think it's super important to make sure that you talk to your plastic surgeon. They make sure that they fit it exactly right. I'll tell you, we actually got a handful of different ones because everybody's tall, short, medium, wide things. So things have to fit just perfect. Also, a word of caution because you don't want to just change things on your own. A lot of times, repositioning is done as a standalone procedure, but also often it can be done with liposuction, tummy tuck, other body contouring procedures. If you're wearing a corset, really need to talk to your plastic surgeon and let them guide you about when to put that corset, how tight, because it can affect the skin and healing of the other procedures. So there's a little bit of coordination. Got to follow the instructions to get the best result.
Oh, so I'm just not going out to Amazon and ordering a corset. But
Sometimes people do. I don't advise it.
do you fit them with the corset and kind of look at it
Mhm.
and say, no, that's not going to
Well,
work?
we do. We tighten it in the office. We make sure it fits. We have them come back periodically. So if we need to change it, tighten it, we can do that for them. 100%.
It actually sounds really beautiful.
It's interesting because I don't know there's a lot of procedures in aesthetics where we're able to kind of control the outcome over a period of time. Most of the time, there's we talk about our expectations, what we're hoping to achieve. You go to sleep, you hope that you wake up, and it turns out like that a couple months later, and you don't really have any say. Some of our patients have really, really loved that they're a part of this journey, and they can help control the ultimate outcome for all
Exactly.
those control freaks out there.
Yes. Yeah. Yeah. That's really me. Okay. You've consulted with a lot of patients then looking to get an hourglass figure. What is the one question you feel that they should be asking you during a consult that maybe many never think to ask?
One, I think people need to ask about the recovery because I think sometimes people aren't in it to win it. This is one where we try to be really, really upfront about people. If you don't wear the corset, if you don't have someone that's going to help you put it on, if you're not in a good spot where you can do this over the next couple months, then don't waste your time and money because you're not going to get the results. You're going to be disappointed with that. I'll tell you the other thing that people are pleasantly surprised is how little pain or discomfort that they have after the procedure.
Amazing. And that's why you keep the pictures so you can show them the surgery really did happen.
Exactly. Because the incisions are so tiny. To them, it's a little mind-boggling how you can have an incision this tiny and get to all three ribs and create that type of transformation.
Could you talk about that just a little bit for at the beauty seeker level, my level? Because I had a broken wrist and I think of that big saw. So that's what I have in my mind. And that's clearly not what you're using.
Yeah, so it's actually a tiny, tiny little probe, and there's actually a couple different ones depending on some nuances. But it actually can go through a tiny little incision. There's even some that are almost look like a kind of little bit of fatter percutaneous needle that can have that same vibration, and then you're just scoring one edge of the bone and able to move it in. So you don't need much access, and because you're not hurting the muscle, you're not doing any of those things. I think that's why people recover so well. If you really think about it, the more that we can leave the soft tissue, leave all the things alone, the less, and it makes sense, right? The less destruction, less damage we do, the faster things recover. So it's doing more with less, which is an overall trend that you're seeing in aesthetics across the board.
Love that. Okay. I just thought, so if you're carving a piece of the bone out, just tiny as it is, where does that go? Does it fall away in the body or?
No, and it's just kind of creating these little openings in the bone itself. Your body will absorb it, and so it's just kind of freeing those areas. There may be a little bit of kind of bone dust up, but your body will absorb that.
Okay, great to know. And now this sounds like there's not going to be much of a scar.
The incisions are half a centimeter at most. They tend to be really, really, really tiny. Sometimes they look like a little brown dot if you got some darker skin. If not, then it's hard to see in most people. I remember giving a presentation once. Somebody was asking me where the scar was. I couldn't find it on the picture. I'm sure it was there somewhere, but it's pretty amazing how well these heal.
Okay, so you wouldn't even need any kind of scar guard or laser to get rid of the scar. You just really don't have a scar.
Yeah, I mean, everybody heals a little different, so I'm not going to go that far to say that you shouldn't take care of your scars or do these things. I always think you should. It's easier to be proactive than not. But people are pleasantly and often very surprised how small the incisions are.
Yeah, this sounds amazing. I've never heard of anything like it.
I do think when people are looking, they should ask somebody, how much experience they have doing the procedure. It's one of these things that I think when done right by someone who's experienced, I do think that people can get tremendous results. Obviously, the ribs overlie the lungs and other things, so you do want someone that's done a lot of these and has a really good understanding of that anatomy to be doing this procedure for you. So I think a super fair question. Hey, where did you train to do this procedure? How many have you guys done at your practice? Fair questions.
Okay. I talked to Dr. Manzanata,
Yeah.
who also
Mhm.
does it. Yeah, he trains.
Who's a world expert? Yep, 100%.
Okay. And he said, for the procedure that he trains in, there's been about 7,000. I think when we interviewed a couple weeks ago, it was growing to be more than that. What is a lot of surgeries, that practice point where, a
You know,
patient.
obviously he's at one end of the spectrum, and when he's talking about all the people who've trained or done procedure stuff, I think really for something like this, honestly, if somebody's done over 20, you're in a good spot. The learning curve is really short, but I don't know that you want to be patient one or patient zero. And so honestly, at 20 you'd be great. He's at an extreme end of the spectrum where I don't know most people are going to get to, but yeah.
Yeah, perfect. Okay, that's great to know. Okay. 20 would give you the experience roughly that you might
For
need.
sure.
Okay.
And especially when you're talking about most of these are board certified plastic surgeons. This is an expansion of the skills that they've done. Most of us did hand surgery, other things. So, if you use the same piezotome for rhinoplasties, other procedures on the body. So again, it's the skills that we've already done, just refining them to a different bone.
And the only way you can do this surgery is with a piezotome. Is that correct?
That's not necessarily true. Before the PCO people used other saws. I think the PCO makes it safer. I think it makes it more predictable. I think it definitely makes it easier. So I'm not going to go as far as saying you absolutely have to use it. I do think it's revolutionized the procedure.
Okay, it does sound revolutionary. Beauty seekers, here's what you just learned. Rib remodeling is not rib removal. It is a minimally invasive procedure that reshapes the waist the same day, and you go home the same day. And the practice of wearing a corset is essential. The ribs heal at a new angle, and the corset is what holds the shape while they heal. Skip it, and you lose your future hourglass. Dr. Franco, you just told us that a snatched waist is not something you are born with or without. It is something that can be sculpted. Thank you for being here. We really appreciate you.
I love this. Thank you so much for having me.
Thank you for being here, beauty seekers. From the bottom of our hearts, please subscribe. Every subscriber is how we keep bringing you surgeons like Dr. Franco, who tell you what is actually possible in the world of aesthetics. Coming up next, Dr. Franco is going to tell us how a BBL can take that hourglass figure even further. A bigger booty, fuller breasts without implants, using your own fat. And yes, BBL once had a reputation as the most dangerous procedure in plastic surgery. He's going to tell us exactly what changed. Don't go away. Dr. Franco, we just talked about getting a more defined waist with rib remodeling, but a lot of beauty seekers want the full hourglass shape, the waist and the curves. If someone wanted to take that hourglass shape further, how would you enhance it?
I think Brazilian butt lift has been one of the hottest procedures for years.